Welcome back to the Pearl Report. Within 2 decades, the number of people in Hong Kong suffering from various types of multiple sclerosis rose 6-fold. The actual number is small compared with the general population, and many patients feel that condition has slipped under the radar. And actually, the ailment affects sufferers in more ways than we expect.
Peter experienced his first MS symptom in June 2005 when he was 41.
I had a splitting headache. I eventually went to the emergency room, but the doctor treated me as a regular case and prescribed medicine.
He took the meds and rested for a day, but the headache persisted.
Later, I got up from bed. However, my left hand and the left side of my face were numb. I didn't feel anything below my 5th rib. The doctor immediately hospitalized me.
Peter was given steroid shots, CT scan, electrocardiogram, blood test, ultrasound scan, and MRI scans.
They took more than 40 MRI films. Neurologists examined them and diagnosed multiple sclerosis.
A type known as relapsing remitting MS.
The relapse is due to inflammation in the central nervous system. The patient should experience new symptoms or worsened symptoms for at least 24 hours or longer.
Remissions are the intervals between relapses, which can affect different parts of the body each time. The other types of MS are primary progressive and secondary progressive. Relapsing remitting is the most common, affecting about 85% of the estimated 2.5 million multiple sclerosis patients around the world. About 400 of them are in Hong Kong. Their ages range from 18 to 52. The average onset age is 27. The patient ratio is 3 females to 1 male. After his diagnosis, Peter quit his job as a technician.
I had a mortgage to pay. My wife and my kid were crushed. Everything fell on my wife's shoulders.
His wife works as a clerk.
I was mostly at home alone. My mind often wandered. I even devised ways to kill myself because it was excruciating. I had more physiotherapy to fix my knee joints. Almost bursting into tears, I was gradually able to walk again, slowly, but only with a walking frame.
Peter suffered his second MS attack in September 2006.
Returning home, my legs went limp. I collapsed to the floor. I had 3 more bottles of steroids injected into me.
Steroid is actually used during the acute attacks to hasten the recovery, to reduce the after effect of the inflammation.
We do not fully understand what triggers a relapse. Some conditions can trigger a relapse. For example, during a urinary tract infection or chest infection, the immune system is activated and there is production of some inflammatory mediators.
After his second attack, Peter became wheelchair-bound. His third attack came in November 2011.
I was on the pedestrian trail. My back was suddenly in great pain. I had 5 more bottles of steroids injected in me. That's a total of 13 bottles. They caused my joints to hurt. After my 3rd MS attack, my bladder was ruined. I became incontinent and needed to have tubes inserted. My vision became increasingly blurred.
The optic nerves get inflamed, and patients typically complain of blurring of their vision. They can improve, especially with treatment that can hasten their recovery. But on the long term, patients with repeated attacks may accumulate permanent visual loss and even blindness.
Now I have to consult almost 10 specialists because MS might hit you in this spot today or in another tomorrow. I feel like a time bomb, never knowing when I'd explode. I'm glad I still have strength to push my wheelchair.
Peter has been a member of a support group, the Hong Kong Neuromuscular Disease Association, for 6 years. Currently, it has around 370 members, 130 of them MS patients.
After joining the association, I feel uplifted because I see some members are worse off or better off than me.
Besides lobbying for government support through advocacy, we also promote public knowledge of our difficulties.
I dubbed MS an acute yet invisible disability. When people see me, many of them ask if I had a stroke or a traffic accident, but it never occurs to them it's MS.
It's only natural that a minority is overlooked. It's also a cultural thing. We Chinese people are not used to bring our problems out into the open.
45-year-old Michelle had her first symptoms 15 years ago. Frequent headaches, bodily pains, and numb limbs. A general practitioner only prescribed her painkillers. She eventually turned to a specialist who recommended an MRI to detect any cancer or tumors.
He only said there were many lesions in my brain, which won't be found in normal people's brains.
Some other diseases can have lesions on the MRI brain that mimic multiple sclerosis. Still, it is a disease that needs to be confirmed upon exclusion of other diseases that mimic it.
Michelle has relapsing remitting MS. She was working as a secretary and she continued in her job for 6 to 7 years, going about quite normally without a cane. She has had about 6 relapses, usually at intervals of 2 to 3 years.
Recent years have seen more relapses. I can't walk for long, can't go far, can't carry heavy things. About 6 years ago, I started having to use a cane to dare walk on the street.
That was when Michelle started on interferon injections thrice a week.
I'll be injected until I grow old, until I die. I'm actually terrified of the needle. I know this disease is incurable. I just hope to suppress it and prevent relapses. Then I'm already very happy.
Interferon has the effect of reducing the number of relapses and also slowing down the accumulation of neurological deficits. At the present moment, we don't have any medicine to help the nerve to regenerate after it has been damaged.
Still, at this moment, there is no cure for this disease.
Some fellow MS patients tell me after taking their Chinese doctor's herbal medicine, they can walk around at home even if they've been wheelchair bound. So I gave it a try, but so far they haven't worked miracles for me.
We need to look at these individual reports very cautiously. The patient may incorrectly attribute the improvement to a recovery or a cure of the disease by itself. So that is not scientific to believe that.
In my most recent attack, I couldn't get up, couldn't move my legs. I worry when I can't walk anymore and have to be in a wheelchair, not going anywhere, missing out on a lot.
I was born in '64, so I think I'm 49.
Chris is from Britain. He has secondary progressive MS.
In this phase, the patient started to have progressive deterioration of their disease even without relapses. Some of the patients can still have occasional relapses, but irrespective of having relapses or not, they will have a gradually downhill course, which is irreversible.
The speech difficulty is quite recent, the last 2 or 3 years.
When the nerve fibers in the brain are affected, muscle contraction and coordination of these muscles for our normal speech will be affected.
Chris discovered his fate from an MRI scan in 1996, 9 months after he got married. His symptoms began earlier.
Sometimes I have tingling, and it's kind of like pins and needles. You don't become secondary progressive one day. It takes years and years.
Chris took interferon until 5 years ago.
Once you enter secondary progressive or the more advanced stage, its impact will be very little.
Chris is slowly losing his dexterity.
Have to be careful eating and drinking and speaking.
The contraction and coordination of posterior part of our tongue and also the pharyngeal muscles may be affected. When this difficulty in swallowing occurs, the most severe scenario can cause sudden death.
I think it's usually solid food. Usually gets lodged in his throat, so we take it out. Like that. Get the food out. Sometimes I have to feed him and cut up the food and put on a spoon and feed it.
Your family and friends, it's a big shock because it develops, and the biggest burden is the people around you.
I don't mind helping him to get around. It's not going to hinder me.
Jessica was born when Chris was in his early stage of MS.
He could still walk because it slowly gets worse, so he's just in a wheelchair now. It was pretty upsetting.
Well, it affects your whole body. Everything is gradually more difficult. The silver lining is to develop a mental strength to suffer and go through, but it can be done.
Most vital is whatever the disease, however serious, try to treasure your loved ones and accept it with optimism.
Like my dad can't even walk or can't move and need a wheelchair, so people should be grateful that they can move around and don't take it for granted.
Even though it can be very debilitating, very hard, very testing, don't ever give up. Your attitude is your life. Okay, Mary, if you drop it, you're a C.
Well, thank you for watching our show. It will be re-aired on Tuesday and Saturday, as well as on tvb.com. Until next time, from the Pearl Report team, good night, good luck, and good health.